patient care.
When do we want it?
Now!
I'm Wang, I'm a psychologist. I used to work for Kaiser. So I was fired on April the 9th, and really that happened on 3 different levels, right? Just logistically, I was given a last chance agreement to sign and to return to the company. And I did that, but I wanted to document that I was protesting the way that the discipline was handled and that we would be grieving that process. And actually management refused to accept that and ultimately fired me. On a different level, really they're claiming that there are patient issues that happened. And really clinicians are fired if there's a serious gross negligence that happens or if there's some ethical violation of your license. And none of that happens in my case. Right? I think that the deepest level is just in terms of retaliation. So it's not just happened to me. A lot of other staff and stewards have either been pressured out or they've quit on their own. So it's really the larger context.
And why are they being pressured out?
Well, I think Kaiser doesn't really pay attention unless you happen to speak out about patient care issues. With the Department of Managed Health Care, there's an ongoing investigation of whether Kaiser has enough appointments and providers to provide appointments for
And
patients.
what's the cost to a Kaiser member or the public if you can't get appointments quickly in healthcare?
Yeah. So that really depends on your situation, right? For some people who are generally stable and they're not in a crisis, waiting a little bit of extra time may not make a huge difference, right? But for some people who are in a crisis, that difference in days can make a real difference, right? There are cases where some patients have unfortunately committed suicide while they're waiting for an appointment, right? So for some patients, that's a critical difference.
Why doesn't Kaiser have enough clinicians to take care of that problem since they're a big company that has a lot of profits?
Right. So Kaiser has a lot of resources, right? I think it has the capacity to really do things well and really help patients. For some reason, in the psychiatry department, in the therapists that are involved, I think it's chosen to not staff adequately to do the job that it can do. And I don't know if it's a financial reason or political reason, but it's just choosing not to do that.
Well, haven't they been fined in the past for this by the state of California?
Right. So the Department of Managed Health Care, I think, had a $4 million fine, kind of a wake-up call to Kaiser. There was a follow-up study, and there's the possibility of possible ongoing fines if Kaiser doesn't correct the problem. So I think the union is filing a grievance on my behalf, and so I'm really going to let that process play out. I certainly would like to be reinstated, if the charges are dropped, but I think at a much higher level, the company needs to make a decision to really stop retaliating against people who are speaking out for patients.
And what has been the effect of this retaliation on the staff in the psychiatric department at Kaiser?
Right. So I know it certainly is terrible for morale. I worked in Fremont, and I believe, my understanding is I think 4 or 5 staff have, in the last month or in the next months, have filed to transfer out of the department, right? And it just means there are fewer staff available for patients at that clinic. But certainly region-wide, I think some of the reasons that people are out today, and they've been out all week, is that they really have a problem with how they've been treated, right? And morale is certainly low when we feel the management is not backing us out.
And what can Kaiser members do about this who are unhappy about what's happened to you and other clinicians?
Sure. So certainly patients, if they want to, can file complaints within Kaiser. I mean, that's a first step. Kaiser is trying to reconcile the problem, and I think there are mechanisms in place where that can happen. If they don't feel they have a good response, they can always appeal beyond Kaiser to the Department of Managed Health Care. They can certainly talk to their own providers, if they are receiving treatment in the psychiatry department, to really request appointments that they need. So I'm very proud of the union to be a member and a steward. They're certainly doing all that they can to appeal the process. I think right now they're requesting documents, and Kaiser's in the process of submitting some documents.
So you're a steward in the union?
Well, I guess I was, but
is that part of the retaliation? You think because you were speaking out and defending people as a result of the conditions?
Right. So really, the stewards are really the front line of regular staff who have taken the extra step to represent other coworkers in the department and really to try to give voice to the patient care issues. I think those people are being particularly targeted.
So it's an illegal labor practice?
I believe so.
So what do you see the future? I mean, there's been a fight to make mental health care part of general health care, and yet it seems like when you try to make sure that people are getting the mental health care they deserve, you get retaliated. What does that say about mental health care?
So again, I really hope that this is an opportunity for Kaiser really to do the right thing. Right? It may take a lot of these cases that are happening, but so what's happened to me is not really unique. Right? It's happened to other stewards, again, who have been pressured out or they've retired early because of the working conditions. Hopefully, unfortunately these are happening, but hopefully this sends a message to management, sends a message to the public. It gives an opportunity for Kaiser really to respond and to do the right thing. What do you mean we're coming here?
When do we want it?
Now! What do we want?
Patient care.
When do we want it?
Now.
What do we want?
Patient care.
When do we want it?
Now.
What do we want?
Patient care.
When do we want it?
Now.